Hello, I'm Andy Reynolds, Master of Ceremonies at NCQA's Health Innovation Summit 2024. Phressia is a lead sponsor of the summit, and to learn about Phresia's work to improve healthcare, I'm speaking with Phresia's Chief Clinical Officer, Hilary Hatch. Hilary, welcome.
Thanks for having me.
I'd like to discuss your thoughts on value-based care. I'm curious about your work, your impact, and what you see coming in that area. So I'll ask you three questions. What, so what, and now what? So let's start at the beginning. What is Phresia doing to improve value-based care?
Yeah, thanks for asking. So we think patient activation is the invisible foundation to improving every other measure of quality. Nearly all measures depend on getting patients to do their part, getting them to get a vaccine, a mammogram, a colorectal screening, getting patients to take their asthma or diabetes medication, or follow through on a plan to treat depression and so on. As a company, our mission is to make it easier for patients to take an active role in their care and reduce staff burden to meet their goals. And we do it at scale across 150 million visits a year. We're also the measure steward of the patient activation measure, a well researched way to measure and improve that foundation to all quality.
And what can you tell us about the impact, or how do you answer the so what question? How do you know that you're improving care?
So, decades of research shows us that when patients are activated, when they have the knowledge, skills, and confidence to self manage their health and healthcare, outcomes improve, costs go down, satisfaction with care increases. Pretty much every quality measure in value based care falls under one of these buckets: outcomes, costs, and satisfaction. And patient activation is a big lever, and we need to pull on it to get the results that we want. Um, you asked now what? Now what? I think in addition to the decades of research studies, but one of the things we talked about at the conference is that we now have evidence that incentivizing clinicians to support patient activation in a payment program, in this case, in the Kidney Care Choices model, it worked as we expected it to. Patient activation improved, and the other clinical outcomes did too. So, expanding this approach to other populations and settings and disease states, it's not a risky move anymore. We've really proven it.
I'd like to drill into how your own thinking or knowledge has evolved. What do you know now about these topics that you didn't know, say, 2, 3, 5 years ago? What have you learned?
Well, one of the things that I learned is that I thought it would be harder for organizations to implement interventions. I thought that it would take more work. And none of the kidney care choices groups that we worked with, none of them had heard of PAM before the model, the CMMI model started. And yet 85% of them were able to implement an intervention within the first year to improve patient activation. And it really came down to one simple thing. They took their existing resources and they put those resources towards the patients that they had measured were the least activated. And the way things typically work in healthcare is that we give the resources to the patients who raise their hand. So, the patients all have clinical risk in a population like kidney care. So that's everybody has a high clinical risk. But the patients that would say, sure, I'll talk to a care manager or a pharmacist or a nutritionist, those are the patients that would get the resources. And the patients who declined are actually often the patients that needed it. So that simple shift, to me, that was the most startling finding, is that simple shift made such a difference.
And you mentioned a couple of acronyms. Let's just make sure that people new to these topics are following along. You mentioned PAMD and I believe CMMI. Can you define each of those, please?
Yeah. So CMMI is the CMS Innovation Center. That's where they put out models to test different ideas. And in this case, they were testing if we support patient activation in the kidney care population, will we see better outcomes? Will we see costs go down? Will we see satisfaction with care improve? And that's what we're looking at over the course of 5 years.
And you mentioned that you were surprised. What did you think would happen? In other words, you've told us what did happen, and that was a positive result. But what did you expect? What did you think you would see?
I think some of the things that I thought would be easier were harder, and some of the things that I thought would be harder would be easier. You would think that collecting a bunch of surveys for people, that doesn't sound that hard. And creating an intervention, that sounds hard. But it was really the reverse. I think there's a lot to be worked out about implementation and making it easier to collect data, reducing survey fatigue, tweaking measures to make it work better over the course of a model. And we got it done. The model participants, the groups that were in it were amazing. But what was more surprising was their ability to actually intervene and move scores so much in a period of time.
Do you think this is scalable? Can other people do what they did?
Yeah. Well, I mean, the first year results came in and patient activation scores improved 3 times over what we typically see in usual care and about twice what we see um, in a sort of typical care management intervention. And let's talk about what that really nets out to for clinical outcomes and patients' lives. It meant that more people started dialysis in a planned way. That's a quality measure called optimal starts. More people went on home dialysis, and more people are on transplant wait lists. You can imagine that just has an enormous impact on people's lives.
And I want to make sure I understood or heard you correctly. You found a 3x and 2x improvement over what you expected?
Well, we expected incentivizing clinicians to make a difference. We didn't know how big the bump would be. You're
Wow.
incentivizing people and saying, look, focus on this, and dollars are attached to it. We expected that to get people's attention.
Right.
It made a big difference. And you asked what that leads us to think. Well, there are a lot of other chronic diseases that are very similar to kidney care. And so supporting patient activation in those areas, we think is key.
I think you just told us about some of it, but can you
Yeah.
spell it out for us again? What is the rose in value-based care, what you have seen of it?
I think the rose was when we incentivized clinicians, we saw what we expected to see. Activation improve, and the outcomes that we expected to improve alongside of them, they improved also. So when things go the way you're expecting them to go, that's a win. When your hypothesis bears out. What's not going well? Implementation of feel like we're on the bleeding edge of implementing a patient reported outcome performance measure. It's hard. It's a lot of work, and there is a lot to be done to make it easier, and that's our company's mission, to make it easier. So we certainly find lots of opportunity in healthcare to do that.
Why is it hard and how do you make it easier?
I think that in practice, patient surveys have typically been done completely outside of the clinical care setting. And so in kidney care, was not a lot of experience on how to collect it within the clinical care model and use it to drive clinical decisions and drive care team resourcing. And so that was all novel, and it took some work. Collecting the data, reporting it to CMS, those are all things that I think we can smooth out and make easier over time. But I think the important thing is that if the results aren't there and the value isn't there, you can't make it easy enough. It doesn't matter. And so I think when patient reported data is thought of to be sort of a nice to have, patient voice, oh, that sounds really nice, let's do that. It needs real hard evidence that it's making a massive impact in value-based care for people to sort of say, okay, it's worth doing this extra thing. Now let's just figure out how to make that easier.
Well, you've outlined the rose. Every rose has its thorn. You mentioned the bleeding edge, the challenging part. What can you tell us about the bud? And we define the bud as the flowering next thing or the opportunity that maybe people have overlooked? What do you see there?
Yeah, I mean, I think kidney care has been a big focus because it's so expensive. It's leads to a lot of terrible outcomes for patients, and dialysis is really hard on people's lives. But a lot of chronic diseases follow the same pathway where people are, for a long time unaware that they have a disease that's developing. And patient activation is key to having them be diagnosed earlier, treated earlier, and have better outcomes, lower costs, and to feel more engaged in the process and in their choices.
What other diseases do you have in mind, other chronic conditions to which we might apply what you've learned?
Yeah, so we see great outcomes across cancer care. That when patients are more engaged in their care, they tend to feel that their values are reflected. They're more satisfied with their care, and they have better outcomes. We see great outcomes in behavioral health. We see a lot of potential in all of the chronic diseases like heart disease and um, diabetes, certainly. All of the diseases where when patients are engaged earlier in their disease journey, we can see a tremendous impact.
Wow, well, that's an ambitious agenda, and it stands to reason that what you've
I
learned in
mean, the patient is the common factor, right?
sure, sure. Another question we like to ask our thought leaders, our sponsors, is about their billboard. If you could put up a billboard anywhere that millions of people who work or care about healthcare quality would see, what would you want your billboard to say?
Well, I would say in terms of kidney care specifically, 37 million Americans, 1 in 7 has chronic kidney disease, and most don't even know about it until their kidneys fail. So 360 people each day start dialysis. We now not only have tools to diagnose and treat, uh, slow the progression of kidney disease, and alternatives to dialysis that radically prolong and improve people's quality of life and reduce costs. And if the key to that is supporting patient activation so that we can ensure that people are diagnosed earlier, they get on treatment sooner, and we slow the progression of disease. And if they happen to be the ones that end up on dialysis, they will be able to transition to home dialysis or get a transplant. I think that's a pretty exciting venture to be on to make that happen.
Certainly, and if anyone has ever had a friend or family member with kidney disease who needed dialysis, you know that it is something that can take over your life.
Yeah.
It is
And
such
that's really what it comes down to, right? Is that people can live longer and more fulfilling lives if they're not going 3 days a week to get dialysis. And by the way, I always think about this. The invention of dialysis saved lives. It's an incredible thing. People were able to live, but now we have alternatives, and we need to be able to get people to those too.
we're coming up on time, but I should confess to our audience, people watching us, that I had an inside look at what Hilary's been talking about today because I saw most of her presentation at the Health Innovation Summit. But Hilary, for people who weren't lucky like me to be in the room, can you give us a brief overview again? What did you do, and what did you share with the group at the Health Innovation Summit?
Well, I had the privilege at the summit to speak on a panel with Dr. Robert Taylor from DCI, one of the participating groups in the Kidney Care Choices model, who spoke from the perspective of what it was like to do this work and implement the patient activation measure and to try to drive the other quality measures in the program. And Eric Schneider, NCQA's own Eric Schneider, was our moderator. And what we talked about is just how to what was working and what the results were and where we thought we could move to make it easier over time to do this kind of work. It was a great panel and very exciting.
Hilary, I know you need to go. We appreciate your time. Thanks for chatting with me today.
You're welcome. Thank you.